Thanks for joining us at Less Stress Zone, Holistic Health. On this channel, we take a holistic, science-based approach to health and explain complex medical topics in a way that's simple and practical. If you're looking for clear, trustworthy health information, make sure to follow our channel so you don't miss any new episodes. Our topic today is atherosclerosis, a silent disease that can develop unnoticed for years, but may lead to heart attack, stroke, or other serious complications. Atherosclerosis is a chronic inflammatory disease of the arteries, marked by the buildup of plaques, fatty deposits made mostly of cholesterol, inside the vessel walls. It begins with damage to the endothelium, the thin inner lining of the artery. This allows LDL cholesterol to enter the wall and trigger inflammation. Immune cells respond and start to accumulate, forming the early stage of a plaque. As it grows, the plaque protrudes into the arterial lumen. Over time, this buildup can gradually narrow the artery and restrict blood flow, reducing oxygen and nutrient delivery to the organs. If the plaque ruptures, a blood clot may form and completely block the artery, leading to a heart attack, stroke, or other serious complications, such as limb ischemia, kidney failure, or aortic aneurysm. Atherosclerosis can develop in any artery supplying blood to our organs and tissues. That's why symptoms vary depending on the location of restricted blood flow. When atherosclerosis affects the coronary arteries, the vessels that supply the heart, we call it coronary artery disease. Narrowing of these arteries causes angina, typically triggered by physical exertion and relieved at rest. Typical angina feels like pressure or burning pain in the chest, most often on the left side or behind the breastbone. It may radiate to the neck, jaw, left shoulder, left arm, and even down to the wrist and fingers of the left hand. Sometimes the pain is felt in the upper abdomen and may resemble indigestion. This is considered an atypical presentation of coronary artery disease, where cardiac symptoms mimic gastrointestinal discomfort. Classic angina usually lasts a few minutes. However, if blood flow becomes completely blocked, for example, due to a sudden clot forming at the site of a vulnerable plaque, the heart muscle is deprived of oxygen. This leads to a heart attack, medically known as a myocardial infarction, a serious and potentially fatal event where part of the heart tissue begins to die. Prompt medical intervention is essential to restore circulation and prevent permanent damage. When atherosclerosis affects the arteries in the legs, it causes pain in the calves during walking or running. This symptom is called intermittent claudication. Pain typically occurs after walking a certain distance and is often described as cramping, stiffness, or burning fatigue in the muscles. It forces the person to stop and usually goes away after a short rest, typically within seconds or minutes. It's more common when walking uphill than downhill and usually affects the calves. In the worst-case scenario, a sudden complete blockage of the artery supplying blood to a limb can lead to acute limb ischemia. This typically presents with severe pain, followed by loss of sensation and motor function, and if left untreated, it may result in tissue necrosis and, in many cases, require amputation. Atherosclerosis can also affect the arteries that supply blood to the brain. For a long time, the narrowing of these vessels may go unnoticed, but when symptoms do appear, they often indicate recent episodes of brain ischemia. Symptoms may include motor or sensory disturbances, most often affecting the limbs on the side of the body opposite to the area of brain ischemia supplied by the narrowed artery. There may also be speech difficulties, particularly when the dominant hemisphere is involved, as well as vision disturbances, typically on the side corresponding to the narrowed artery. In severe cases, a stroke may occur, a sudden and permanent disruption of blood flow to part of the brain caused by the blockage of an artery previously narrowed by atherosclerosis. This is a critical, life-threatening condition that requires immediate and intensive medical intervention. Atherosclerosis is also a common cause of aortic aneurysm, a bulging and weakening of the body's largest artery. Over time, the vessel wall may dissect or even rupture, which is a critical medical emergency associated with a very high risk of death. Many factors can significantly increase the risk of developing or accelerating atherosclerosis. These include an unhealthy diet, smoking, lack of physical activity, high blood pressure, abnormal lipid levels, such as high LDL, low HDL, and elevated triglycerides, as well as increased blood glucose in prediabetes or diabetes, and excess body weight or obesity. Other contributing factors include chronic stress, chronic kidney disease, autoimmune and rheumatologic disorders, and the use of certain medications. Atherosclerosis develops in the vast majority of people, often silently for many years. It can begin as early as childhood, but the first symptoms, such as angina, claudication, or stroke, usually appear after age 50. The pace of progression varies widely. Some people have slow, stable disease for years. In others, it advances rapidly and leads to early complications. It depends on how many risk factors are present and how intense their effect is. What's more, in recent years, atherosclerosis has no longer been a disease of older men only. It's increasingly diagnosed in women, in younger individuals, and in populations from low and middle-income countries. Heart attacks in people in their 30s and 40s are no longer rare. That's why taking preventive action and building lifestyle awareness is crucial, well before symptoms appear. Fortunately, there's something you can do about it. Atherosclerosis can be significantly slowed and stabilized, especially in the early stages. More and more studies confirm that intensive lifestyle changes, including proper diet, regular physical activity, avoiding tobacco and excessive alcohol, and healthy daily habits like sufficient sleep, stress reduction, or proper hydration, can help restore vascular health and reduce the risk of complications like heart attack or stroke. If you're interested in practical, science-based tips, we cover dietary guidelines and physical activity recommendations in more detail in one of our earlier videos titled How to Reverse Insulin Resistance. You'll find the link in the description below. These guidelines closely align with those for preventing atherosclerosis. Thank you for watching. Remember, small daily choices can lead to big changes in your long-term health. If you found this video helpful, give it a thumbs up and share it with someone who might benefit. See you in the next episode.